Can't. Yeah, there we go. All right. Well, in the interest of time and keeping this to an hour, I will go ahead and get started. We might have some folks joining us as we go. But welcome everyone. This is the October 2022 Genetic Ambassadors Call. We have these calls about quarterly, and we haven't had one in this new grant cycle. So this is our first one for our new grant cycle. Oh, I see Lourdes joining. So I have some updates for you. Some of you who are on state teams might know some of these things, but just some reminders. And then I have an exciting idea that I want to bring forth to the Genetic Ambassador group for a possible thoughts on a project idea that this group might be interested in. So let me go to the next slide here. As always, we like to start off by acknowledging our funding from HRSA. And from Department of HHS. If anybody has any more questions about that, you can visit hrsa.gov for all the details. And I don't see, oh, I do see someone new that not everybody on the call might not know, but I know I've been working with her because she's our new genetics navigator for Utah. So Christina's on, but just in the interest of, if there's anybody else new that I'm not seeing on my screen here, this is MSRGN. These are our 8 states. I was talking to somebody today. I said, we go from the tip of Texas all the way up to the Canadian border of Montana and everything in between, and then a little to the left. So that's our region. Today's agenda, these are some of the things that I had that I wanted to update everybody on. We always start off with introductions on this call. I feel like it's one of my favorite parts of these calls because it's how we connect with others in other states and maybe some even in our own state that we haven't met. I want to give you a genetics summit and a genetics pop-up update. And if you all didn't hear yet, our Variants of Uncertain Significance video has premiered and is live. And so this group was very instrumental in giving some feedback on that video. And so I want to make sure that you all have that link. And then I want to talk about this project idea about insurance resources for families. Mention our cross-pollination funding that's wrapping up in October, and then also give an announcement about our Wyoming Genetic Navigator. So with that, this is the part of the call that, like I said, I just love the introductions part. So I usually pick a question for this one, and we just go round robin, so we all get to know each other. The question I picked for today, oh, that's me. Let me go to the question slide. The question I picked for today was, what do you think is one of the biggest myths associated with genetics? And I will tell you why I picked this question after we all go round robin and share. And it's something that I've been thinking about recently, putting together some trainings. And so I'll start off. I'll go back to my slide here. I'm Christy Weiss, the projects manager for Mountain States Regional Genetics Network. Came to this work as a family member with a child impacted by a suspected genetic condition. And I think I'll start off with answering the question. I think one of the biggest myths that I've heard a lot just recently is that and everything that looks genetic is genetic. And I'll tell you where I just heard this just yesterday. I was listening to a Rare Genomes Project webinar, and they were talking about how they have come up with cases that look like an individual is definitely, it looks very, very positive that they're impacted by a genetic condition. And the whole genome sequencings are coming up with conditions that are non-genetic causative. And so I think that's one of the things. I think when you get in the genetics realm, we keep looking for answers, and there are some conditions that can look very genetic that are not genetic or do not have genetic causative factors. So that's my myth for the week. I'm just going to go and call on who's on my screen, if that's okay. And then if you can't talk, just say pass, or if you don't say anything, we'll just go on to the next person. But Kathy, you're next on my screen. So do you mind introducing yourself?
Hi, everyone. I'm Kathy Salazar. I am in Albuquerque, New Mexico. I work for Parents Reaching Out. I'm the Family to Family Healthcare Information Center coordinator for New Mexico, and our Families as Faculty coordinator for the University of New Mexico Medical School. But mostly I'm a mom. I have 9 children, and 6 of my children are all adopted. And so one of the things that we keep running into as far as a myth is concerned, and something it took me a while to figure out, is that if it's genetic, it has to have an origin with birth family, not necessarily be spontaneous. And the reality is that a lot of genetic conditions are spontaneous. And so for us, especially having adopted children and not having anywhere to go, we have to make that assumption that what they're dealing with is spontaneous, since we don't have necessarily any birth history information. So that's one of the myths that I've come to learn about.
Yeah, thank you for sharing that. I think that's really helpful how you explained it, because I've also heard a related myth of well, since we don't have the birth family information, there's no reason to do genetic testing, and then maybe you run into that as well. So
yeah, we did.
Thank you for sharing that. All right, next I have on my screen Debbie Bridge. Hi Debbie, thanks for joining us.
Hi guys, I haven't been on here in a while.
That's okay, we're glad you're here today.
Thank you. My name is Debbie Bridge, and I am the mom of a 31-year-old ASD. And I also work, and I am the policy coordinator for Texas HHSC. I work for the Children's Autism Program. So that's my life. And I tend to agree with Kathy with the myths associated with genetics.
Thank you. Thanks for sharing it. Did you catch our autism webinar we had last week? If not, I'll send you a link.
Please send it to me. Yes.
Okay. Yep. We recorded it. Yeah, okay. Definitely. I thought of you and just when you were introducing, I'm like, oh, I wonder if she was on that. So I'll send it your way.
Thank you so much.
Thank you. I actually think that in the autism world, I think that webinar for me cleared up a lot of myths, I think that are out there around autism and genetics. So I'll point everybody to that one if you're interested in things related to autism and genetics. So next I have Winton, and I know she's getting lunch. So Winton, do you want to introduce yourself? Or there you are.
Hey, yeah. And can you send me that link too? I am interested in that webinar.
Absolutely. Yep. I will. I'll see if ask Michaela, see if she can pop it in the chat for me.
Great. Thank you. I am Winton Wood, and like Kathy, I am here in New Mexico, down in Albuquerque. I work at the UNM Center for Development and Disability. I am a self-directed developmental disabilities waiver. Well, the self-directed waiver, not that I'm self-directed. I'm a program manager for the MeVIA self-directed developmental disabilities waiver. And I am mom to 2 children. My oldest has Down syndrome and autism and is medically complex. Happy to be here and see you all.
Do you have a myth?
Oh yeah, right. Not really. I mean, definitely agree with Kathy. And other than that, just kind of like in layman's terms, maybe because genetics for my generation, it was kind of still extraordinarily mysterious. And in the past, 15 years, we've just made tremendous strides. So when I was younger, I think it was that we were just starting to think about, is it nature or nurture? And one of the myths when genetics became all over the news was that, oh, you are makeup of your genes, which is a myth. You are partially a makeup of your genes.
Good one. Thank you. Oh, and thank you, Michaela. She found it. She put the autism webinar in the chat there for anyone who's interested in that. And that also has CME credit. So if you want to pass that along to your primary care provider or nurse practitioner or PA, that has CME available for the recording. All right. Thank you, Winton. And next up on my list, I have Christina. Christina, do you want to introduce yourself?
Yeah. Sorry, I'm driving to keep the little guy entertained for a moment here.
No worries.
I'm Christina. I am primarily mom. Everything I do for work kind of centers around their needs, which is why I'm working a lot with genetics and research stuff now. I have a total of 11 kids that have touched our lives through stepkids, birth, and foster. And 3 of the 4 that I gave birth to have spontaneous genetic issues. 2 of them have required surgery, and 1 of them is incredibly medically complex. And I'm the founder and CEO for the CAST Gene Foundation. And I just recently signed a contract to do research data analysis for the Rett Syndrome Research Trust. So it's my whole world right now. But
Awesome. And can I add, and you're just finished your training to be our Utah genetic navigator.
That's right. Yes, that's important too. And I'd say I really agree with what they've been saying about the myth of genetics always running in the family. Like I said, all 3 of my kids' problems are spontaneous. We don't really know exactly why it's happening or why we have so many like that. But I would even take it a step further in putting it in parents' terms by saying that it's not the parents' fault, that it's not to be a source of guilt when they're dealing with these things, even if it does happen to more than one of their kids. I mean, granted, there are some cases where parents know for certain what likelihood a child will become, but for the most part, that nobody knows these things automatically without a lot of intervention and testing. But I would also say that the other myth that I was thinking of is that genetic testing will only bring you answers and insights, because honestly, sometimes it just brings more questions.
That's a great one. Yeah, you hit the nail on the head there. And I wish our genetic navigator, Jen Bonoff, was here from Montana, because I think her answer to the first myth that you guys have been talking about is her favorite term is de novo, meaning that it happens, a de novo change happens, not passed on from person to person, but spontaneously. So, all right, next up I have, thank you, Christina, welcome, and glad you're here. And next up on my list, I have Hannah. Hannah is our Nevada genetic navigator. Would you like to introduce yourself, Hannah? And we're talking about what's you think one of the biggest myths associated with genetics is, if you want to answer that.
Sure, yeah. Sorry for my lateness. I was in a doctor's appointment. And yes, I'm Hannah Barnhart, the Nevada Genetics Navigator. And I guess my background is healthcare administration, and I used to be in Alaska, and that was where I got introduced to genetics and used to run the only pediatric genetics clinic up there. So I guess to answer the question, what do you think is one of the biggest myths associated with genetics? I don't know if this has been mentioned before, but I think coming from the other side of it, so as someone who worked with the genetics providers, the genetics researchers and all that, they're actually wonderful people that would love to dedicate their time, if money was not an option, to help find answers. And I think some people kind of think, oh my gosh, you can't really approach them, they're just so kind of out of world out there, like kind of think of like Space Odyssey type, but they're not. They're just like wonderful people that have a passion for genetics, and whether they're a researcher or a provider or a counselor or someone like me who worked the administrative side of it, we just want to give you the family's answers as best as we can.
Great points. Thank you so much for sharing that insight, Hannah. And next up, I have Joy showing up on my screen here. Joy, would you like to introduce yourself?
Yeah, my name is Joy Clark. I am here in Montana, and I recently joined this group back in March of this year, just as a parent who does have a kid, a child that has Down syndrome, and so and some unique health issues regarding some metabolic issues. So I hopped on a Zoom meeting randomly that I found on Facebook, and that's how I kind of got introduced to this group.
Great, thanks for being here, Joy. We're glad. This is your first meeting, I think, right?
It is, yes.
Yeah, and do you don't have to answer the question about the myths, but are there any myths that you want to share that you've encountered?
I guess I'm just kind of so new to it that I wasn't really aware of any kind of personal myths of my own, but just aware of myths among providers and about what genetic testing can offer, and just even the perception about insurances being able to cover it. I've done a lot of my own research, I guess, just delving, when you have a parent that has a child that has unique health issues, you kind of delve into things on your own. And I guess partly, in part from that, what I've learned from my own child is that I feel like while there is a lot of unknown information, I think it's important. I think it's valuable to have that information about your child, because you never know when that information might be helpful for your child later.
Great points. Yeah. Thanks so much for jumping on today. We're glad you're here.
Yeah. Thank
All
you,
right.
guys.
Did I miss anyone? I don't think so. I think I got everybody, but if I missed somebody, will somebody unmute and tell me? I haven't gone yet. I think I got everyone. Michaela, did you want to say just hello, a real quick hello? I think everybody's met Michaela, but maybe not.
Hello, everybody. I think it's afternoon wherever you are. If not, good morning. If we haven't met yet, my name is Michaela Perkins. I am the coordinator, the projects coordinator for MSRGN. I'm here in Texas, Huntsville, Texas, to be exact. A lot of my background is in event management and marketing. So I'm kind of new to the genetics realm, but I'm happy to be here. If you ever need anything on the MSRGN side of things, technical wise or anything else, just send me an email and I'll be happy to help. But it's nice to see you guys and nice to meet the new faces.
Likewise, Michaela. Happy to have you.
Thank you, Michaela. And Michaela is humble because she says she's new to the genetic stuff, but she was our intern last year and helped with our Red Flags for Genetics handout. And we're going to talk about that in a second because we're having a pop-up about that. So she did a tremendous amount of work to make that happen. And this group here, as the genetic ambassadors, if you remember, or been part of this as long, we helped craft that survey. It came out of a project and discussion on this group, and you guys gave feedback on Michaela's iterations of it. So this group really was instrumental in Michaela's intern project and vice versa. So thank you, Michaela. All right, we're going to go on. I'm going to just pop up this slide because this is why I had the question that we have today. And it's because we just launched, if you saw in our newsletter, we just launched a training for early intervention professionals called Genetic Connections. And this slide here is actually one of the slides that we put in that training, because as we were thinking through talking to early intervention professionals about genetics, we really wanted to come at it from why families might be interested in genetics and why some families might not be, and some of the myths and things that might exist out there, and talk a little bit about why genetics is our first module of that training. So these are a couple that I thought of, but you guys have given me a whole lot more that I might need to go back and edit the slide and add some, but some things like all genetic conditions are caught at birth through newborn screening. I've talked with many providers that think that the scope of genetic testing or genetic disorders that need to be diagnosed are caught through newborn screening, and that is a big myth. Not all genetic conditions are caught at newborn screening. I've actually just heard a new number. The number that I had been quoting was 7,000 genetic conditions, but I just heard that is closer to 10,000 identified genetic conditions. So you can imagine that's not all available to us through newborn screening. Every childhood condition is caused by genetics. False. Genetic diagnosis cannot help a child thrive. False. I'm sure some of us have stories here where we were able to help our children through knowing more information about their genetics. All genetic changes are harmful and cause disease. False. I think we think of it in the mutation, deletion, all those words, but sometimes genetic changes are beneficial or helpful. We don't measure those or test those as much, but there are things out there that in our genes that can be helpful to our health. And then this one is a big one. I think I talked to so many people that think that genetic testing is is hundreds of thousands of dollars, when in fact the price continues to drop and drop dramatically over the last 10 years. So these are just a couple of mine, and I want to thank you guys for sharing your myths today. That brings me to the next thing on our agenda, which is our genetics summit. It's coming up. Those of you on state teams might have heard about the state team challenge that we're launching. We're having a little friendly state to state competition of which state can have the largest number of registrants from their state based on their population size. So we're using a fraction, so the number of participants over the number of people in that state to kind of level the playing field, so all of our states have a fair shot at this. So this is the QR code to register. If you haven't registered yet, you can be a vote for your state if you register today. And we are really asking just everybody involved with Mountain States to help us spread the word, to really share this. This is a true gift that we have, the financial backing from HRSA to be able to offer this for free and provide continuing medical education at no cost. So it's really something that we want to spread far and wide through our region and beyond. It's open to families, it's open to providers, both genetic and primary care. It's open to public health individuals. Really, anyone who's interested in genetics in our Mountain State region and beyond is welcome to attend. So the information, if you go to the homepage of the website, you want to get to it quickly, a bar pops up with this graphic on air. You can click that and you'll go right to the page with the agenda and the link to register and all the information. But this QR code will take you there as well. So I'll just pause. Does anyone have any questions about the Genetic Summit, or has anybody registered yet? If you haven't.
Christy, I do have a question.
Yeah, go ahead. Who's that? Oh,
This is Joy.
Yep, I see your hand. Yep, go ahead.
So I was just wondering, can therapists get continuing education as well, or is it just the continuing education for physicians and nurses?
That is a great question. So we have not paid for the therapist.
Okay.
Like I'm thinking you're meaning like OT-PT speech. Is that what you're
Yep.
referring to? Yes, and
Yep.
So we have not paid for those levels. We have right now paid for MD, DO, so that's the CME. And for on the CEU side, we have an application in for genetic counselors, nurses, physician's assistants,
Okay.
Pharmacists, and I think the nurse practitioners can go under the nurses, is what I remember. So I think those are the main categories.
Okay. And how many CEs do they get?
So good question. I think it is 8. Michaela, can you remind me? Is it 8 for the whole thing? 8 contact hours is what I think it comes out to. Does that ring a bell? Sorry, I don't have the website up right in front of me.
It's 8. It should be.
It's 8. Yeah.
Okay.
It's
Thank you,
12
guys.
It's 12 sessions, and they're 30-minute talks with an additional 10 minutes for Q&A.
Perfect. Okay. Thank you.
Yeah, no problem. All right. Anyone else? Questions before I go on? If you need any information, if you need a flyer, if you need a blurb to put in a newsletter, if you need a social media graphic, we have all that made up, and it's linked on this page under our promo kit. But if you can't find that and you need anything specific for something you're sending out, or an email you want to send out, just reach out to myself or Michaela, and we can get you all sorts of stuff.
So Christy, can I ask you a quick question? I was just going to the website to see how
Yeah, go ahead.
easy or hard it is to register for everyone. It's asking for a confirmation number.
So that means you've already registered.
Okay.
So it is actually linked to your email address. And so if you try to register again with the same email address, it's going to tell you that confirmation number thing, because you've already registered. So it's kind of nice because it doesn't let you sign up like 50 times and then get 50 emails about it.
Okay, that's great. I just wanted to know in case I get questions about it. Thank you so much.
Yeah. So you can go in and do a different email if you want to go back through the process, but the confirmation number, I'm pretty sure, is linked to you've already registered.
All right. Yeah, I always try to check when we send it out, for public to attend in case they have questions on what that looks like.
Yeah,
So
for sure.
thank you.
Okay, no problem. All right, the next thing up I have on our agenda is something coming up next week. It is our genetics pop-up. So we're doing something a little bit different with pop-ups this year because we have our genetic navigators in place. They had the great idea that we do these pop-ups more throughout the year so that they could connect with families that have questions. In the past, we've done them all around Rare Disease Day, which we'll still have a pop-up around Rare Disease Day this year, but we're just kind of scattering them throughout the year as well. So we had one in August on with our video, and this one's October 12th, which is next week. And this one is on the Red Flags for Genetics handout. We have that now in English and Spanish, and this is the project that Michaela helped us with. And so she'll be presenting. We'll have a couple of parents on there to talk about their experience with the Red Flags for Genetics handout. And so this is open to anyone that wants to come. As many of you all know, we've done these pop-ups as an outreach to families, but we've had some professionals join us in the past, and we love it when professionals join and hear the family perspective. So anyone can join us for this. And if you go to the Mountain States website, on the right-hand side, the news section, you can find a link to the registration. I have it down here at the bottom. These slides will be posted later, but I just want to give you a guide where you can find this immediately if you'd like to share or send it out. So it's in the news section of the Mountain States website. And my ask for the genetics pop-up and the genetics summit is that if you all could help us spread this out to 3 places that you might know that might have families that might be interested in either the Genetics Summit or the Genetics Pop-Up. We would love for you to share it. Three places just to help spread that word throughout our entire region. Again, if you need a flyer or a social media graphic, those are on the webpage for the pop-up post. All right, and I'm curious. I'm going to change gears here because this group was so instrumental in this. I'm curious how many people got to join us for the pop-up in August and have gotten to see the variants of uncertain significance video. Did everybody get to see it? If not, I got a thumbs up from Hannah. Kathy, did you get to see it? Thumbs up from Kathy. How about you, Winton or Debbie? I see Michaela. Thumbs up. Joy got to see it. Christina, Debbie.
No, I didn't. This is
You
Debbie.
didn't? Okay. Does I can do 1 of 2 things. I can ask Michaela to pop this link in the chat, or I can pull up YouTube and we can watch it again together.
I would love that.
You would love that? Does
Yes.
everybody mind if we watch it again together? It's short. It's only about 4.5 minutes. So let me do this. Let me stop sharing real quick. I gotta switch over. I'm just gonna switch over real quick to YouTube because it seems like it sometimes does better when I do that than this embedded stuff. All right, so here is, let's see, I'm gonna share screen. I'm gonna click this share sound box so it works. All right, can everybody see? Oh boy, no, it's not gonna do it. There, can everybody see that?
Yes.
Okay, let me see if the sound works. Can you hear it?
Yes.
Going to see a genetics professional can come with many emotions. Anticipation of finding answers that may help your child feel better, a feeling of fear of what lies ahead and what your child's future might look like, and perhaps a feeling of being overwhelmed as you process all the new information and new words that you hear during the visit. This video and others in this series are aimed at helping you, your family, and your support system understand all of this new information and new vocabulary that you may hear from a geneticist, genetic counselor, or other medical professionals when speaking about genetics. Sometimes mutations or spelling errors occur in your DNA. This can sometimes change the meaning of the DNA, which can affect your body. Let's use the spelling of cat to help us understand how these errors work. Normally, this animal's name is spelled C-A-T. Sometimes a person might spell it K-A-T. Although spelling it with a K is technically wrong, you can still tell that they are referring to a cat. In genetics, sometimes the strand of DNA is also misspelled, but like this example, the meaning doesn't change. This is called benign, which means that the spelling error is not harmful and will not cause a genetic condition or disease. Other times, someone might spell cat as R-A-T. This time, the meaning of the word has dramatically changed. Instead of referring to a cat, it refers to a rat. This can cause a problem if the person wants to refer to a cat. This could also happen with DNA, where the spelling error completely changes the meaning. This is called pathogenic, which means that this spelling error can cause a genetic condition or disease. Other times, the spelling errors are not so understandable. If cat is spelled C-R-T or C-E-T or C-I-T, it is unclear what the person who is spelling the word is referring to. This can happen in genetics. Sometimes geneticists don't know how a spelling error can affect the meaning of your DNA, and therefore if it causes a genetic condition or disease, or if it does not. These spelling errors are called variants of uncertain significance, or VUS for short. After many studies are done in the lab, scientists may know more about certain variants. For example, scientists might decide that CET most likely means cat. In DNA, this means that the variant is likely benign or likely to not cause a genetic condition or disease. Other variants might be reclassified as likely pathogenic. For example, scientists might decide that CIT is not likely to refer to a cat. This means that the variant is likely to cause a genetic condition or disease. What does that mean for your symptoms or your diagnosis? If you get a genetic test result back that says you have a variant of uncertain significance, that means the doctors and scientists don't know yet if your spelling error causes a specific genetic diagnosis or disease. This doesn't mean you do have a genetic condition or disease, but it also doesn't mean that you don't have a genetic condition or disease. Doctors and scientists simply don't have enough information yet to know. Doctors will use family history and symptoms to address your current medical concern. In the future, doctors and scientists may know more about your variant.
Very nicely done.
Thank you. All right. We would love your help in sharing the word about this. I just checked the other day. I think we're up to over 100 views now since August, which is great. But this was made. Oops.
We're going to use puppies.
Hang on.
To explore the variation of traits
Something's
in
still
plants
playing.
and animals.
Sorry, my YouTube was still playing. We would love your thoughts on where else to share this. We'd like to start contacting our genetics clinics in our region specifically and asking them to use it at the clinic level, because we feel like it's something that could be sent in an email follow-up to a visit, and something that families could kind of digest on their own time. Many times all of this is explained in clinic, but this group I know has talked about this before, that if a diagnosis is being given or other really heavy information, that families often report that they don't hear any of the other stuff or retain all the details. So we thought this video might give families a chance to do that in the comfort of their own home, on their own time, and on their own time that they feel comfortable watching it. So I see.
Christy,
Yeah, go
I'm
ahead,
sorry.
Debbie, go ahead.
I didn't want to jump in front of Joy.
I wasn't sure if Joy's hand was up from when I asked it, who'd seen it, or if you had a question, Joy.
Oops. That was an accident. Sorry.
I'll put it down. I think I can put it
Okay.
down. There you go. I got it.
Thank you.
Go ahead, Debbie. Go ahead.
Well, I
Heather.
was gonna ask, would I be allowed to share the video on my YouTube channel? I don't know, because I don't-
I don't know that you can share it on your YouTube channel because it's based on ours, but you can, like if you have a
The link?
website, you can take the link and you put
Mhm.
the link on social media. You can put it on, you can put it on a website. I know that some of the websites are built now. If you put a YouTube link, it just pulls the YouTube through and puts it right on the website.
okay,
So, yeah, I don't know that we have a way to put it on your YouTube, but some people can make playlists. I don't know if you've ever done that on your YouTube, where you make a
Yeah.
playlist so you can link it on a
Okay.
playlist.
okay, I'll do that.
Yeah, let me just, I'll grab the URL for it right now while I'm in here. And I
Okay,
will pop that in the chat so everybody has that if
Okay.
they have a place that they can share. So. Yeah, so I just want to thank this group. They're really the reason for bringing it up on today's call is just to thank you all so much, because it really was this group that helped give some really great feedback on the video, and it led to some changes in the wording. I don't know if anybody was on from the call earlier in the spring, but like we had some happy and sad faces, if you guys remember. And so we changed that around because I think Kathy, you're shaking your head, you were on really the idea that benign and pathogenic are always good and bad is not really the case when we really talk about people who have been on a diagnostic journey for a long time. Getting an actual answer of what might be causing their child's condition can actually maybe be a very positive thing. So we took out the emotional emojis of that and changed them to just words so that it would be a little bit more neutral. So some of those comments that this group gave, we implemented, and I just want to thank you.
Hey,
Thank you all for
Christy,
Yeah.
when we were doing this last spring and getting ready, as you were going through all of it, that's where we were with one of my kids is VUS, right?
Yeah.
Well, what's good to know about that is because we did the original genetic testing that gave us that VUS, 5-6 years ago.
Right.
Well, they just reran her samples this summer,
Okay.
and now we have a diagnosis.
And now you have it. Yep.
Yeah,
It's been
so
reclassified, right?
Exactly,
Gotcha.
exactly. So it's good to know that it's not always a dead end as it seems. Sometimes with the technology, as it's getting better and better and a lot easier for them to run and look for certain things, we finally, I mean, it doesn't change anything that we're doing, but there's a bit of an answer now. So
Yeah. Great,
yeah.
great point. Thanks for sharing. Thanks for sharing that personal perspective, Kathy. That's helpful. All right, I'm going to switch gears here and just tell you guys about an idea that's been coming up and a resource I found, and I would just love this group's opinion, or maybe a little bit of time in the next week or so when I send this out to you all to take a look at this. So for those of you who got to participate in our part of state teams, we had a summer meeting and we did this thing called Boulders. If any of you were on our May genetic ambassador meeting or watched that recording, we did the same activity. It's the idea of identifying boulders. What are the big barriers in our region that are thinking of a big rock in your way from getting to genetic services for families? And so we identified a lot of boulders in our region. One that keeps coming up and keeps coming up, and it's probably no surprise to this group, is insurance. I even heard it today. I think, Joy, you mentioned it. So insurance coverage is a boulder that keeps coming up, not only from the provider side, but from the family side as well. And so I've really been thinking about this. Over the last year, I've been really trying to see if there were any family-friendly resources out there that were either specific to genetic testing or genetic services that would really help a family navigate the complexities and the intricacies of getting genetic services paid for, specifically genetic testing. And I was kind of coming up with dead ends. I wasn't really finding anything that I thought was really family friendly, and kind of throwing around the idea, well, maybe this is an opportunity for Mountain States to make something in this space that could help. And our genetic navigators have been having this conversation. They're getting lots of questions from families on this. So anyway, last week I stumbled across this resource. And so it's called PLUGS, P-L-U-G-S. It's out of Seattle Children's Hospital. It's a group called Patient-Centered Laboratory Utilization Guidance Services, which is a huge mouthful. But basically, they are an organization that has put together this toolkit. And it is family friendly, family facing. I feel like it's very patient family centered. So I'm meeting with them next week just to understand a little bit more about their organization and kind of how they work. But in the meantime, I would love if a couple of you would be interested in just kind of flipping through this guide and letting me know from your perspective if you think it is truly family friendly enough. The thing I like about it is the guide is not specific to genetic testing. However, it is to, like, the way they the way they word this, complex lab test. So it's more on, okay, not getting a CBC or a complete metabolic panel covered. It's really on the level of more expensive, testing that would be more expensive or more difficult to get approved by insurance. And so just bringing this to you all today to get your feedback on it. And my thoughts were, maybe this group could do something around this, whether that be a page on our website that maybe has, if you guys know of more resources like this, we could gather them. Maybe we could do an infographic. I'm not exactly sure what, but would love your ideas on maybe how Mountain States could fill in the gap in this space, because we're getting so many questions and it's been identified as a pretty big barrier for families in our region. So I'm just going to open up the floor. Does anybody have any thoughts or comments? Has anybody come across this guide and know about PLUGS that I was just in the dark and haven't known about it? Any thoughts? I'm gonna,
Yes.
Go ahead. Is that Kathy?
Yeah, so I just pulled it up and you need a password to get in.
All right, I didn't need one when I did it.
Really?
So
Okay.
I'm gonna pop what I accessed in the chat. So see if this
Okay.
link works. Can anyone get that to open?
Okay, patient caregiver resources. I just went back one page. Huh.
Yeah, it is under patient care. Yeah, so
Yep.
I'm linking directly to the PDF that I found.
Okay, great.
And this is why I reached out to them to ask them for a meeting, because I kind of want to understand. It looks like it's an organization of a bunch of children's hospitals. Like there's if you look on their members page, it's a lot of children's hospitals in our region and across the entire United States that are part of this PLUGS. So I want to understand kind of financially how that's all that all happens. But at the meantime, I'm like, oh, this is a free resource that's out there. So in the meantime, I kind of wanted to take a look at that closer. And that's why I wanted to bring it to you all, because I feel like there's some good stuff in here. I see Winton has her hand up. Sorry, Winton, go ahead.
Hi. Yeah, just comment. Well, I'll read through it and give you my comments, but
is it opening for you?
Yeah, it opened fine.
Okay.
It opened fine.
Okay, perfect.
This is a great, I mean, this is what we're all looking for. How can we get things done? I mean, besides the insurance thing, it's also the lack of professionals. So the wait times are extraordinary. But Kathy knows, as a state team, we've just been talking about that so much about, crossing state lines. We may need to, because we may not have the wait list in our own state may be really, really long, but then what does that look like in terms of insurance? And it's there's no consistency. Like, we'll see that some out of state services are in network with like our state Medicaid, and some are not. It's just, there's no consistency. It's kind of hit or miss. So this is a good start, and then the next thing I think would be lobbying to make insurances, more consistent with what, how you can go farther than your own state to get services.
So Winton, you know that all of our Medicaids are up for RFP starting now in January. So they're all reapplying to become turquoise New Mexico. And so I guess between you and me and whoever else we can get, especially in New Mexico, with one genetics provider, it's never going to happen here, ever, unless we get, more support, because we're having to go to Colorado. And so, maybe that becomes a talking point as they start looking for comments on the new providers for you and I for New Mexico, because it needs to be part of the Medicaid, how you get resources through Medicaid, what is payable, all those things. It's a bigger deal than that, but we're going to be switching names and switching the possibility of which companies. So yeah, it's a big deal. And I don't know who all has all of that's going on, but we do here in New Mexico.
Yeah, thanks for that insight. Sounds like a much bigger boulder than we all can maybe chip away at this moment. But I feel like sometimes starting small with answering some day-to-day questions might be a place to start. So that's really why I bring this to you all, because this is like a not getting all the insurances coordinated, but really one-on-one. Parent gets a bill for a test, or parent gets a bill for a visit, and then what's the next steps? To me, that's what this guide helps walk families through. Not only the terminology, but really what are their next steps? What are their rights to an appeal? Things like that. So, but I felt like this was different than all the other things that I was finding out there, because I think a lot of these guides are very general. And this one specifically, again, if we're talking about genetic testing, to me, this one is a little bit more on the complex, because it's focusing on complex lab tests. There's that piece of medical necessity and getting a letter from your provider to say that this is needed, and the CPT codes matching the diagnosis codes or the suspected diagnosis code. So I think it's a little bit more complex because it is complex lab testing, but I think it also, this guide seems to me to keep it at a pretty understandable level. So I would love your feedback. I will send this out as a follow-up to all our genetic ambassadors, just asking them if they would take a look at it and let me know. But for those of you on the call, I popped it in the chat, and if you have some feedback, and then on our next quarterly call, we can kind of bring that back together. I can bring back the information that I learned from the group that when I meet with them next week, and see if this is something maybe we can talk about, how, what to do next, maybe to help families in this area. Excuse me. I know we're just coming up on our last 10 minutes, so I just wanted to mention two more things, and then hopefully have a little bit of time for any questions at the end here. We do have a opportunity for some extra funding that has come up, and this is something called cross-pollination funding. I know our state team members have heard about this, but this really isn't just for state teams. It's really for anyone in the Mountain States region and any of our 8 states who has an idea and they want to collaborate possibly with another state in our region to make that idea happen, and ideas around access to genetic services. How do we improve access to genetic services? So we just recently extended the deadline till October 31st. All this information is on our website under the news tab. You can find a post about the cross-pollination and a link to the application, but I wanted to just throw it out here to you all, because you might have some ideas that you might want to pursue on your own outside of your state team, or as genetic ambassadors connecting between states. So just wanted to throw this out, and if you have any questions about it, I'm happy to answer those. And then last but not least, I just got word that our genetic navigator, Melody in Wyoming, is moving. We're really happy for her and her family. They're going to be moving to Ohio, but really sad for Mountain States, because that means she's not going to be able to do genetic navigation in Wyoming, because she's not going to be there physically anymore. So we are looking for a genetic navigator in Wyoming. We just opened the application today. It'll be coming out in the newsletter, and I'll be putting it up on the website. But if you have any connections in Wyoming that you would like to connect me with or share the application with, please just let me know. reach out to me or chat me, and I'll get you the application over to you. All right, that's all I have, but I wanted to just leave, hopefully, yeah, we have a couple minutes left for Q&A or comments or discussion or sharing between ambassadors. Anyone, the floor is open. Anyone have any stuff they'd like to share or comment about? And I'm gonna grab a drink of water. Oh, and thank you, Michaela. She put the cross-pollination application post in the chat. Thank you so much. I'm going to go back and revisit the plugs thing. Does anyone have any thoughts around just helping families navigate the insurance stuff? I know our family to family health information centers probably get a lot of questions about that, and Kathy's shaking her head. Have you ever come across anything that's genetic specific in that realm?
It's more generalized frustration on the length of time that it takes to get in to see, especially if they're not necessarily inpatient with something acute going on.
Yeah,
so it's the length that, yeah.
It's actually mean resources. Have you ever come across any resources to help people?
No, I was looking through this, and actually it's very usable as it is. It's got a lot of places to check off for families on things that they can do, next steps to take. So I always love when it's just very bullet pointed for families that they can just kind of go through really quickly without reading a paragraph and know what they're looking for.
I felt that way too. I felt like it was very practical.
Yep,
very practical, and you didn't have to read the whole document to get the gist of it. You could go to those checklists and get the short version, the Cliff Note version.
And you don't need to necessarily go to Seattle Children's to use this. It's just usable by anybody.
Exactly. It's not specific to them. Yeah. Winter, did you have a comment? Oh, I thought you were going to start to say something. How about anybody else on the phone? I mean, I know Christina, Joy, Debbie, maybe. Have you guys had to navigate insurance for your own kiddos' own situation? With getting denials or appeals?
Well, I can't speak too much on it, but from my personal experience, early on, I decided to just not cover my son and just have him on Medicaid and Medicare since he is dual eligible, because it just made it much easier and less heartache for me, because oftentimes he would get denied services, and it would be a spat between the insurance company and Medicaid. So, and unfortunately, I hear that where I'm at right now.
I was just going to say, I've heard that as well. So that's a good concern to bring up. Yeah.
It's really sad. It's very stressful. A lot of clients or parents call into the toll-free line, and I receive a lot of that these days. Being, on a wait list for the diagnostic testing, and it's just very convoluted and just very.
And what you're saying is it's kind of the two insurances are duking it out. Is that what you're alluding to? Yeah. Okay. Yeah. And unfortunately, the family and the individual is caught in the middle.
Suffer. That's correct.
Yeah.
So I was just going to mention, I've not actually gone down this road yet. My daughter is still waiting to get genetic testing, but that is coming, well, just to get the appointment. But that is coming up end of October. So I guess going through some of this might be helpful beforehand, so I know what I'm kind of coming up against and how to advocate. I guess from my personal experience, I've kind of had to advocate and negotiate with insurances before for getting certain things covered, especially when I was pregnant. I did opt to get some unique testing done that my insurance denied. But I don't know, have people found it useful? Like, I guess in my situation, when I was negotiating with the insurance companies, I wrote them directly and gave them the ABC rationale for why this was important. And then I still had my provider contact them I don't know, has anybody like tried to approach things that way? Or I guess the unique situation for me is I'm a nurse, so I kind of come to the table with a little bit more medical knowledge than maybe other parents do, but I didn't know like if that's helpful in situations like this when you're trying to get genetic testing covered. Or
Yeah, thanks for sharing that, Joy. I do know some families who have written their own letters simultaneously with providers providing kind of the medical necessity side of things. So I have heard in the past that can be helpful. But again, you hit the nail on the head. It's whether the family feels comfortable, right, articulating that or writing that in the terms that they know. And so that looks different really for every family. And I saw
Sure.
Hannah's hand up. Did you put it down, Hannah? Did you have a question?
Oh, no,
Hi,
I was
Michaela.
just gonna echo what you were saying, that it really does help. So coming from the other side of the table, just like Joy, having that clinical background as well, it helps. And then at the same time, it also helps that you have a really good medical home, because then you can have your medical home provider, you know, whether it's GP, you know, pediatrics in this case for your kiddos, to write that letter as well of medical necessity. And on top of that, the genetics provider that you saw. And that's kind of how we did it. When I used to run the clinic, is we had the genetics counselor write it. We had the medical home, so it would be the pediatrician write a letter. And then if the family was comfortable, they also wrote their own letter in their own words. And
Okay.
it worked. It worked. So, I mean, sometimes you kind of have to run through a bunch of hurdles. Unfortunately, with insurance, because that's just, I guess, that's the beast that they are, as I call them.
Right.
Yeah.
Thank you
Hey,
for
Joy,
that.
you will give us a great perspective if you maybe want to look at it before you go to your genetics appointment, because I feel like you're at a really crucial point in your journey, right? Where you have that insight. You
Yeah.
haven't had the genetics appointment yet. You haven't had the genetic testing yet, but so I would love your perspective if you think it's helpful for where you
I
are
will.
right now.
Yeah, I will certainly take a look at that and see what I think about it for sure and give you that feedback.
Yeah, great. Thank you. All right. Well, we are like 1 minute till the top of the hour. I'm happy to stick on. I'm going to stop the recording, but I'm happy to stick on if anybody has any questions for me, needs any other links or anything like that. But it was great to see you all online, and thanks for helping us spread the word about some of the stuff that Mountain States is doing. And also, please sign up for the pop-up if you want to join us for that, or the Genetic Summit if you haven't already.